Hi, my name is Tammy Richmond. Thank you for joining me today. This is top 10 questions to ask before starting telehealth services. Thank you for joining me. I am the CEO and president and founder of Go to Care. Over the last 8 years, I've had plenty of email inquiries about interest in how to get started in providing services in my private practice or in my setting. I decided it'd be a great time for me to share those common questions to get you started. One thing I wanted to say just before we start is that this is an informational webinar only, and I hope that you gain something from this. Having competency in using telehealth technologies for delivering care is important to protect the consumer and to demonstrate clinical and critical decision making. So this does not in any way substitute for competency gains or skills, but hopefully you'll learn something from me today. Let's look at the opportunities that are out there for us as healthcare providers, as occupational therapists, and why we would want to choose to use technology to help us deliver services. So the first thing we know is that there has been a massive OT and PT provider shortage for quite a long time. Therefore, it leaves consumers without care. A good example of this is just looking at the federal mandated IDEA Part C Act, which includes having schools have to have OTs and PTs available for students. So student-based OT. This is the first area of adoption we have seen in telehealth, and it is a great reason why it works because number one, there's a federal law behind it. Number two, it's very difficult to find enough OTs to provide school-based therapy. Let's look at the next opportunity that's out there for us if we're thinking about providing telehealth services. Number two, our consumers are demanding and are being asked to have control over their healthcare spending and their healthcare decision making. And so when we have consumers who have been in charge of buying their policies, healthcare policies, being educated, being in charge of their healthcare and fitness, they begin to expect something out of us in return. So there is this interest, especially in the millennials and the younger ages, under 60, that they begin to use technologies that they own, that they use every day, to have some choices in their healthcare spending. So for instance, putting money or time into an app, counting your steps, doing pain journals, looking at other ways to use their technology to do all parts of their life. Number three is storefront rehab has become less profitable due to just therapy caps and the shifting in the reimbursement rates. So everyone's looking for a way to increase their revenue streams. And we'll talk about a little bit later today, but one revenue stream that often gets lost is what do we do with our cancellations? So let's say we have a patient coming in and we hate for them to miss, but like out here in California lately, we've had fires, so there's road closure. So do I have to cancel that patient? They have to cancel with me, or could I jump online and see them for their therapy session? And so therefore, right, this opportunity, this alternative way to do service makes sense. Number four, the traditional care paradigms lack the automated clinical decision-making tool sets. They don't have the automated outcome metrics. Like I don't automatically, when I see someone in person, have all those outcome metrics with me unless I have someone filling in paperwork. And our traditional way of providing services can't really fix the gaps in services. So those gaps being someone comes home from the hospital today, they'd really like to start occupational therapy tomorrow, but they're going to have to wait, right? Wait for multiple reasons. Wait because they're waiting for a nurse to open up the case. Wait because they're not even sure where to look for services. They're waiting for the doctor to write an order. And so in this traditional care paradigm, there are these moments where telehealth makes sense and these gaps that are still there that could be satisfied with quality services. And then number five, there is this true over-utilization of low-touch patients that drive up costs and or they take up spaces. So for instance, I may see a patient who I gave them a splint to wear, and then they go home and they forget how to put it on. They look at it, it doesn't make sense. So now in the traditional care paradigm, they would have to come back to my office, set up an appointment, right? See me, come drive back, just to go over what I've already shared with them. that's a good moment to look at, well, gosh, this is really kind of a low touch patient. I don't really need to put my hands on them. I need to re-educate them. I really need to put them in charge of their home exercise program. Therefore, the appropriate level of care solution would be for me to jump online, right? That would make sense. So they're not having to go through that traditional care paradigm, but me making an appointment, maybe on the spot, saying, listen, do you have time today at 2:30? We'll jump on for 30 minutes. I'll go over that splint with you. So these are just ideas and concepts for you to think about why it makes sense for us to move into telehealth services. Okay, my top 10 questions that I get most common, or top 10 questions I may be asking somebody who comes to me for consulting services and or products on telehealth. So we have worked for quite a long time under this umbrella of providing evidence-based services, and that hasn't changed. But what you do here nowadays are something called value-based services. So value-based may be actually valued on the science of what we're providing, on that evidence, and to the other extreme, it's the value that the patient wants. That what's valuable to them. And part of that value may be just having access to us when they need it most, right? So the value of access, the value of being at home and providing services in their home or work or school. So let's move on to my top 10 questions. Number 1, do I provide interventions or activities where outcomes for my clients would be as good or better if performed at their home, school, work, or community? So normally what I do is I have people take a piece of paper, draw a line down the middle, and I want you to make 2 lists. On the left-hand side, write down all of the services that you provide that you think would be good or better if performed at their home, at a client's home, school, work, or community. I want you to take the time to write everything down. It would be better, right, if I were to do transfer training from the wheelchair to the couch, if I was actually at their home doing the wheelchair to the couch. I could probably do that online. On the right-hand side of your piece of paper, write down only those people's names, services, population groups, interventions that you feel can only be done in person. Right, so the right-hand side is only those done in person. The left-hand side are services that could be done at a home, school, work community that really don't need me, per se, my hands on them, but I could coach them. And I want you to look at those 2 lists afterwards, and I want you to begin to understand that probably the column on the left is going to be larger than that column on the right, because you're going to realize there's lots of things that we can do through video conferencing. Secondly, I want you to begin to circle or prioritize those interventions or activities that you feel most comfortable providing online through video conferencing software. So again, circle those, prioritize those, and kind of keep those with you as we move on through the questions. Number 2, do I have clients who I know or heard would want my services if I could come to them instead of them to me? Now, I had this experience in the past before I got started where I didn't have any clients who came to me saying, hey, could you and I meet online somehow? Or could I use my cell phone, except maybe to call you, you know? And so often clients don't think of saying to you, unless it's about an app, like, oh, I have this new app, can I use this app with you? They don't normally come to you saying, hey, could you see me online? However, if you were to say to them, would you be interested, right, and seeing me online, you're going to have a different answer. So I instruct people to put together a 3 to 5 sentence or question interest survey. And you're going to give this out to all the clients you see that come to you. And these questions are going to be, number 1, are you interested in being seen through video conferencing software where you work, at home, at school? Number 2 could be, do you own technology that we could use, you know, for an online visit? Number 3, do you have any concerns about privacy and security or other things in using the online technology? Number 4, how would you rate your skills in using technology? Therefore, do you need me to help you get set up? Do you feel comfortable using something that you already have? Do you need any training by me, right? Some people do need technology training. And number 5 may just be something like, you know, would you like to start this in the next month or 2? So whatever your 5 questions are, I think it's important to go back to your client to see if the interest is there. You may have the interest and you may say, hey, I've thought of all these things I can do with you at home. In fact, I think it's better. But they may or may not want to be seen at home. Or they may think, well, I sometimes want to see you, and I sometimes think it makes sense for you to see me at home. And I think that's perfect. I think that's how telehealth works the best, in this hybrid moment where sometimes those services have to be done in person and sometimes it makes sense to do it online, right? Okay, question number 3. Do I have client cancellations of therapy visits that could be done online as an alternative that would allow some continuation of care and demonstrate value to my patient? So this is a long question, but it has lots of kind of parts in it. Number 1, some clinics, when I sit with them, have identified their cancellation rate. So it may be they get 10 cancellations a week and they'd like to not have those because you don't make any money and your therapist is still there. And a lot of times there's no other patient that can quickly come in and fill up that spot. That would be a great moment, right, to have an online visit. So when that client calls to cancel at 8 o'clock in the morning, you could say, perhaps ask that client, well, hey, would you be available at your 10 o'clock appointment anyway if I were to see you online at home? Would you be willing to do that? The other parts of this question are, what about those moments that they need an alternative? For instance, we're now in the month of November. Well, we have a couple of big holidays coming up. So during those big holidays and summer vacations and just that moment that people are moving away, but they're right in the middle of therapy with you, you would like to continue their therapy visits with you. I mean, I've had that experience where I'm right in the middle of seeing somebody post rotator cuff surgery for shoulder rehab, and then they're going to go away for a week or two, right when I think it's really crucial that we continue the exercises. Those are good moments for me to say to my client, listen, I know you're going away, it's a holiday, but do you think you could break away for an hour or even 45, 30 minutes and meet with me, because I hate for you not to be doing these exercises while you're out of town. That scar tissue sets down fast and it's just not a risk I want to take, right? And or vacations during the summer, and or someone's moving away and you'd like to have that relationship continue until you've reached your goals. So all of those things are very possible through the use of video conferencing software and or other types of applications or hardware. And so yes, if you know your cancellations, that makes sense. If you don't, just sit back and think about in your mind how many times you have discontinued or you've had to take 1 or 2 breaks away with your clients. Either you went away, they went away, and there's this break in therapy. That's a great moment to have telehealth services. Number 4, do I have clients who've expressed their interest in using their technologies to communicate or work with me? So similar to number 3, but now why I separate out this question is because I sometimes get that question, that clients have said, hey, I have this app. I downloaded this app. My doctor said to me, I should really watch my steps, count my steps. Or my doctor mentioned to me having a pain journal. And so I'm wondering if I should have this pain journal, could you teach me how to use it? So I have had that experience in my practice where clients have come to me, especially with new apps they've read about in an article somewhere online and home, and they're going, hey, I heard about this app and I would like to use it. Or I just got this new iPad Pro for my birthday and I'd like to use it somehow, and there's all these apps, how do I use my technologies? And so the client comes to you and they're asking you actually to put together something for them using their device or their interest in applications. And then you're being asked to yourself, hey, can I do this? Number 1. Number 2, how would I bill or code for this? Number 3, I suggest you ask what goals are being met by the application. So when people have called me, providers have called me with this question like, well, listen, what do I do about using my client's hardware? Am I liable? What do I do if they want to use an app? How do I document that? How do I include that in my practice? Well, number 1, there are some great articles on the use of apps and devices at AOTA online in their website. So do some reading, number 1. Number 2, I always ask my patient, my client, well, what were the goals you were trying to reach with the application? And they may say, well, my doctor wants me to reach 5,000 steps a day. And then I have to look and think about, well, is that important to what my goal is with the patient? So the patient's saying, I find value in that. And so I'm saying, well, they value that. I probably should be finding value in that too. But does that somewhere fit along the goals I have established for the patient? Am I going to include that in my goals if the patient has value with that? And so again, you're the critical thinker here. What goals are being met if we use that application, right? And does that application make sense for the patient and for me to include in therapy? So if there's yes and no answers all over, again, before you get started, using the application is not telehealth. Telehealth is only when you and the patient are not in the same place physically, and that you're the only way to meet is by seeing them online. The use of applications, some people do include that under assistive technology, or they may include it under telehealth, under education or monitoring or surveillance, but it's not that video conferencing type of telehealth. So again, understand the difference, understand if you want to use the technology and the apps for the goals that you're doing. And then the bigger question is it the iPhone versus PC? And I get this question a lot. Again, I'm not going to tell you how to have a relationship with your patient. What is important is the quality of the service. So if you feel that you could look at your iPhone on that little small camera, 2x3 inch, whatever it is on your phone, or 3x4, and you can see that patient well, and you're comfortable with that quality of service, you're liable for that, that's great, then you can do that. Versus I prefer using my PC only unless I'm caught, not next to my computer and I need to do a last minute, therapy session. I like to have a bigger camera. Number one, I am liable through my professional liability insurance for everything I see inside my camera. So if I'm looking at somebody through my small iPhone, my smaller iPhone, sometimes I may miss some of the details in the background, like that cord, that chair in the way, and I don't want my patient backing up when I'm telling them to back up away from their phone, right? So I can see what they're doing to demonstrate something. So again, it's about liability, it's about quality of service. And I'm gonna leave that up to you, the critical decision maker, to decide which is better, iPhone or PC, or maybe it's just what is available at that moment. Number 5, do I have the knowledge or competence required to understand how to use technology for types of services I want to provide? Normally that question comes to me as, do I need additional training? So number 1 is, I'm not sure. I don't know you, I don't know your skill level, but this is what I recommend first. Number 1, go to your state regulatory language under OT, your state regulations, and if there is a telehealth policy or regulations, see if there's anything in there and whether or not you need additional competency or educational PDUs or EDUs. Normally, I don't see that, but what they will see, what you would normally see in state regulations is that you have to be competent in everything you do. So you are still left to your own know-how to decide whether or not you know enough. If you don't feel you know enough, then I would say there are several things you can do. Number 1, you can continue to come to webinars and other educational moments like conferences and learn about how to use those. You can sign up for training services. I provide some. There's other therapists out there providing training. You may want to, I have an address at the, email address at the end of this webinar. You may want to visit the Regional Telehealth Resource Center and take some of those online courses to have a better knowledge. Some of it just comes from, I have a piece of hardware and I need to know how to use it. Or I just purchased the software on a monthly basis to provide video conferencing and I need to know how to use the software. So that's just about the training part. Most of the time, what I feel where my providers get hung up at is they think they can do it easily. They're ready to jump online and then questions come up, well, oh, I need equipment, or what do I do about equipment? Do they have equipment? Do I send them equipment? How do we work that out? And/or do I show them pictures? Do I just demonstrate? I'm not quite sure. Another common question is, well, how do I document at the same time when I'm having the online service? Those are all very good questions, and all of those in their own right are a whole nother webinar. So if you have those questions, then I would ask you to continue to seek out answers for those. Some of it is just hands-on training. Some of that is sitting back and going, well, what do I do now, right? If I were to go online with my patient, they do need to see something. So if I'm going to teach them how to do something, I can either demonstrate it, or I can have 5 steps to putting on a shirt. I can, all those things. So normally you have to figure out what's the best way to share visuals with your patient, digital interventions that would make your services be of quality. If it's simply talking and demonstrating, that's great. If you need equipment, yes, they need to get the same equipment you're going to use. So you may have to discover a way to make sure they get the equipment and who's going to buy it. Number 6. Do I have the skills in using technologies, both in hardware and software, that allow the ease of use? So again, back to where we were just talking about. So what are my choices of hardware? Where there's notebooks, there's iPads, there's mini notebooks, and there's multiple devices now. Again, whatever you choose on your end is up to you and your sense of comfort and quality and liability. On their end also, right? So you may have to use what they have. Important part of that is you may ask them to bring in the hardware, if it's possible to see them in person, to go over the accessory package, because maybe they need larger font. Maybe you need to provide, voiceover type of thing so that they can interact with you better. And again, maybe you're going to discover that you need more training. And sometimes that's just, you finding a colleague or finding a family member or someone else just to practice. Hey, you practice being my patient. I'll be the therapist. Tell me if this works. That kind of thing. Number 7, do I have clients that have personal technology already? So although it feels like everyone has a gadget, you'll find a lot of people all do have a gadget. It's usually an iPhone. I mean, even my seniors who are 90 years old will have an iPhone. However, I will not do a video visit through their iPhone. I don't think it's good quality, and they're still fidgeting with all the small buttons. So number 1, what do they have? And before you get started in telehealth services, what are you going to do if they don't have the right technology? How are you going to say no? What is your alternative to them? Do you have iPads that you can lend out? Would that be a way to take care of that problem? Are you going to spend the time training them with what they do have? And then again, this is my little asterisk. Do they have the technology skills? And the next advanced question to that is, if they don't, is there somebody next to them, with them, a caregiver, a spouse, a grown child, or them, or another friend that they're willing to have sit with them in a session with you that can handle the technology because they can't? And so you'll find in the next question, we call them e-helpers. And I guess that's the next question coming up. So number 8, do I live in a state where telehealth has regulations? I would say a lot of states do. If they don't have if your OT board has not passed telehealth regulations or guidance policies, then your state probably has. And you would have to get to know your state laws. That's the bottom line. You have to know what your state says. Yes, most all states have some sort of regulation. It's either done by the OT board, or the OT board may say to you, we are not in a position to put out anything at this time, or we take no position on this. We haven't been asked to, or we don't have a position yet. Therefore, what you are supposed to do as a provider is go back to the bigger state laws and just look up telehealth, Wyoming, and see what's there. It's your responsibility to dig around and get to know your state laws. There are some, AOTA does have on their website under telehealth a state map, or a state, I think it's a PDF of every state, all 50 states, and it will tell you where they are at with their state telehealth laws. Number 9, does the client, like we were talking about this earlier, does the client present any medical conditions that may exclude them from using their technology or require them to require an e-helper? So we used this term a while ago. It's just basically someone who can manage the technology while you're seeing them, or be there just in case something goes wrong. So for my clients, some of my clients, I really need someone to handle the keyboard, because I want them situated about 6 feet away from the camera so I can ask them to do things and I can see them. Therefore, they can't keep running back and forth to the computer to, you know, to answer me or to push a button or to see the next page or whatever that is. So sometimes I have required an e-helper being there, especially if they're already a more complicated patient, like we're doing transfer trainings, or if I'm doing a home exercise program and I need someone to load on the weights to the patient or the TheraBand, then I would have to have an e-helper. So you want to keep that in mind as you decide whether or not the types of patients you're going to offer this to works, right? And whether or not if they have with them an e-helper. The last question is really now sit back with your list that you may have put together from the previous questions, with your thoughts, with some of your concepts, with your ideas of starting telehealth services, and then take out another sheet of paper. I call this the ABCs of starting. So you have an A column, a B, and a C. So draw 2 lines, turn that paper landscape, put 2 lines down there, and you have ABC. So what are my assumptions? Well, I'll give an example. Assumptions. I assume that all of my clients have a gadget, a device of some sort. And that's probably true, but that's one of my assumptions. Number 2 is I assume, right, that I can just use the hardware I have. I assume that I can easily get a hold of software that I can use for video conferencing. So you're going to put all your assumptions down that you had probably prior coming to this webinar with me, right? And some assumptions you may have now. I assume that everyone wants to see me online, because who wouldn't want this option, right? The B is, what are the benefits? So what do you think the benefits are of you providing telehealth services? And maybe that's why you're even here with me today. But I want you to write those benefits down. Why? Because you're going to, number 1, use it on your marketing materials. Number 2, when the patient says why, you're going to go, because of this, right? Because of these benefits, because it makes sense for me to see you in your home, because you have to perform this every single day at your home, and my clinic is not your home, right? Things like that. And then the C part is constraints or restraints. What are the constraints for providing my services? Now, this is a little more in the sense of you digging up the constraints. Number 1, maybe I live in a state where there's no clear regulations and I need to get more information about whether or not I'm regulated. Number 2, what are the federal regulations for HIPAA? Number 3, I can use this software, but it's not for healthcare. Like I may be using WebEx at school. It's not really as private as it could be or should be. So how do I take care of that issue? So it could be that I need to put together an informed consent that says we're going to be using this software. Keep in mind that we will avoid using personable and identifiable names and other things during the service. So you may have all these constraints. So it's ABCs of starting your telehealth services. Once you finish these, right, you're coming back to, well, now what? How do I capitalize on this opportunity? Well, in a nutshell, you know, it's your next piece of homework. Number 1, you're going to decide the software, the hardware. You're going to decide whether or not what you're using and how you could use it. So go out and start looking for that software if you don't have any already, right? I want you to look at that first list of the services I could do in person, online, and those I can't. If once you've prioritized that, then you need to go to number 2 here. You need to establish a program with specific service solutions that you have identified on those areas that you feel most comfortable in starting. And maybe it's only a part of that. So maybe I'm only wanting to do feeding at home and early intervention, but I want them to come to the clinic for other moments. So maybe my first part is just feeding. So it's, again, looking at that list you created under question 1 and then saying, let me just start there with those clients. And I'm going to give them a little survey and ask, right? Remember my interest survey? I'm going to survey those clients in feeding to see whether or not they would be interested in just having telehealth for that moment. Then moving on to where we go next. Well, you need to know your state laws, right? Before you get all this really going and active, did I go back and am I complying to federal and state laws? Do I need informed consent? What are my regulations in my state? If I can't find them, who do I ask? I've got to ask somebody. I need to feel comfortable. I need to call my professional liability insurance to make sure I'm completely covered, right? So you need to do all the right, dot the I's, cross the T's under compliance. Lastly, you want to begin then to get started. And how does that work? Well, you've got to market to your existing clients, right? So you're going to say, hey, starting January 1st, 2019, I'm going to be providing telehealth services from my office. If you're interested, please see me. And so you may want to begin just posting something in your clinic, in your office, you know, in an email that states you're going to begin at a certain date. I think that helps you, and that certainly helps the clients. When you kind of start here and there, then everyone is not quite sure what's going on, and there's some confusion, I always feel, that goes on. And what often happens to my consulting work, because the client comes back to me and says, you know what, this didn't really start the way I thought. And most of the time it's because they just sort of let one therapist take off and didn't really put together a marketing campaign around the telehealth service. So what's next? You need to develop a plan. I went through those steps for you. How do I answer some of the questions? Well, here are some email addresses for you. So if you just look up in Google telehealth resource centers, you're going to find this great place. There's 12 telehealth centers across the country. They're broken up into regions. They have a lot of services and products and resources for you. Some of them are free. I think most of them are free. And then I think out here in California, we have through our Telehealth Resource Center, they have a great program development kit, they call it. And so here's the address for that. If you're listening to me and you don't have time to write all this down, then just email me, Tammy@godacare.com, right? And I'll be happy to send forth those web links. And again, if you need any other information in regards to telehealth learning or PDUs and consulting and getting your services off the ground and learning more about a platform, I use GoToCare as my platform that I use for services that I created. Then just also give me a call or email me at Tammy@godacare.com or contact@godacare.com. All right, thank you so very much for joining me today. I hope that this was a meaningful webinar, and I will look forward to speaking to all of you once again soon.